Good evening, everyone. My topic is comparing FAS using OCT angio in prediabetes and diabetes without retinopathy. No financial disclosure. An introduction. Diabetic retinopathy and macular edema are significant complications of diabetic mellitus leading to loss of vision globally. Pericyte loss may be one of the early and important etiology for the development of retinal microangiopathy in the form of microaneurysms. OCT angio has emerged as a valuable tool for identifying diabetic patients without DR, detecting early microvascular changes such as microaneurysms, capillary dropout, decreased parafoveal vessel density, enlargement of the FAS. So the FAS mean area ranges from 0.3 to 0.7 millimeter square, and the mean diameter ranges between 300 to 700 micrometer. Absence of vasculature and the overlying inner retinal tissue are believed to maximize the optical quality by reducing the light scattering. So enlargement of the FAS in clinically apparent no signs of retinopathy patient makes OCT angio particularly useful for early diagnosis and monitoring. So the key mediators include pericyte loss, increased vascular permeability and leakage, macular ischemia, and loss of capillaries. Role of OCT angio is to detect the early microvascular changes such as enlarged FAS, microaneurysms, capillary non-perfusion areas, parafoveal decreased vessel density. And the aim and objective of the study is to evaluate the FAS at the superficial and deep capillary plexus with the help of OCT angio and to compare these changes between the prediabetes and diabetes without retinopathy. So the patients who had come to retina OPD with who fulfilled the inclusion and exclusion criteria were included in the study, and a total of 92 eyes, 46 patients. In that, 23 were cases who are diabetes and 23 were control who are pre-diabetes were included. And it is a hospital-based prospective observational comparative study, and the duration was along 1 year from August 2022 to 2023 and was conducted at Nathiradama Super Specialty Hospital. So using the SPSS2 version software, ANOVA and standard T test and p-value less than 0.05, the statistical analysis was done, and using the manual method, the FAS was calculated. So the results include the age. It was mean age was around 30 to 60, and both the eyes were equally affected. And microaneurysm was found in only the cases about 17%, and the glycemic indices were increased in the cases. And UCVA was found to be 0.3 according to the logMAR in cases and 0.2 in controls. And the FAS, I will be explaining the detail in discussion, was increased in the cases compared to the controls. So this was a horizontal and vertical mean diameter. This level of superficial capillary plexus in the FAS was increased in the cases compared to the controls. And discussion. So OCT angio works by capturing the detailed images of blood flow in the retina without the need for dye injection. Unlike the traditional fluorescent angiography, it utilizes motion contrast imaging to detect blood flow by comparing the sequential OCT scans. This allows for high resolution visualization of the retinal and choroidal vasculature, providing critical data on vessel density, perfusion, and structural changes within the retinal layers. So this was the OCT picture which was obtained using the spectralis machine in our hospital, wherein the manual method was used to calculate the mean area and the mean diameter. So 92 eyes were examined. In the mean age was 31.9 males and 60.9 females, and mean age was 47.8 males and 52.2 females. It was not statistically significant, and microaneurysm was only seen in 17.4 patients, and the FAS was in that this level of superficial capillary plexus was found to be 0.83 against the cases which was 0.4, which was statistically significant, and the deep capillary plexus mean area was found to be 2.92 among the cases as against 0.45 in the control group, and the FAS superficial mean plexus horizontal diameter was found to be 864 against the cases cases against the control group 572, and the vertical plexus superficial mean diameter was found to be 932 against the control group which was 605, and the deep and horizontal was also found to be very higher. IOPs were not statistically significant. So the similar study was conducted in 2020 by Young et al. In Korea, and 64 patients were examined, and the study found that in non-diabetic retinopathy group had lower foveal vascular densities and increased FAS areas. So to conclude, the OCT angio stands at the forefront of ophthalmic imaging, offering critical insights to the early microvascular changes in the patients with prediabetes and diabetes without retinopathy. Its ability to non-invasively detect and quantify the subtle vascular alterations makes it an indispensable tool for early diagnosis, risk stratification, and management of diabetic eye disease. As technology advances, OCT angio will likely play an even more pivotal role in preventing vision loss and improving the outcomes for diabetic patients. Thank you.
So what are the limitations of this study?
So we didn't calculate according to the duration of the diabetes, the patients were not included. As well, many important parameters like the vessel perfusion density and the other parameters were not included because we didn't have any software to convert and change. So only the fast microaneurysms and capillary non-perfusion areas were included in the study.
No, other one is that there can be artifacts, projection artifacts.
Projection artifacts can be also, yes ma'am.
And sometimes the machines is not able to, you have manually to measure the fast, because many times we are getting erroneous readings ourselves also.
Yes.
That can be due to the poor scan qualities, which can be in high myopic patient or poor persons or poor cooperation due to the patients.